My name is Dr. Sandra Cabot, and I'm here today with my colleague and good friend, Dr. Marvin Anderson, who's come all the way from Michigan, where he has a practice specialising in helping children with autism, and he's come here to share his wonderful knowledge and research with us, which is wonderful because Dr. Anderson is a medical doctor who is a specialist in internal medicine and has a vast experience over many years of using nutritional medicine and really helping to reverse diseases holistically. So it gives me great pleasure to welcome you today, Marvin.
Thank you.
Yeah, fantastic.
Nice to be here.
Yes. So today we're talking about your favourite subject, and one that you've helped so many people overcome, and that is autism. Now, not everybody understands autism. What does that mean? So I think if you could explain to us what that means and what the symptoms are.
Well, it is a disease that it probably has many causes, and there's a lot of overlap in the symptoms, but there are some commonalities.
Yes.
And the three of them that really come to mind, the classic ones, are, first of all, it is a disease that affects communication.
Yes.
Children are largely, oftentimes, nonverbal.
Yes.
The second thing, it's a disease that, an illness that affects their sociability. The
Yes.
easiest thing to say is that they're in a world of their own.
Yes.
They wander off and so on.
Yeah.
And then the last thing that is really a commonality, Sandra, is that there is a tendency to do repetitious things.
Yes.
Called stims. You know, they may twirl some beads around their fingers and so on like that. And if I could add a fourth, it's very, very frequently the gastrointestinal system is involved.
Okay.
And that does include the liver.
Yes. So they may have abdominal pain, which they can't communicate about, or they may have bowel actions that are irregular.
That is a very, very good observation. Actually,
Yeah.
their inability to communicate leads to tremendous frustration.
Yes.
They can't tell you they're in pain, so they may bang their heads or they may scream and cry out. There was a little boy in our clinic, and he had a computer there where he could indicate what he wanted, you know, on the computer screen. And he just went into a tantrum, you know, and we couldn't quiet him down. You know what he wanted? He took his computer screen, opened it up. He wanted a glass of water.
Yeah. And so you'd have to point to what he wanted.
That's right.
Yeah.
And we have to try to develop the language.
Yes.
Capacity.
That's right. Yeah. Well, as you said, they have trouble communicating, particularly trouble communicating verbally. But what is the form of communication that is most effective if you have a child with autism?
It's very difficult. You have to show them the object,
Yes.
you know, and see if they want that, if they point to it or grab it, you
Yes.
know. And then the next step is to, you know, show them a picture that's transportable.
Yeah.
And then the third thing is to try to have the machine say the word, like
Okay.
water.
Oh, yes.
And then when they point to it, and then maybe they will sooner or later say water.
Yes. Yeah, that's good. Thank goodness for computers.
You know,
We're gonna help a lot
we're
of-
in a world of computers, and
Yeah.
that's not going to change.
That's right. Okay, so you know, we say what is autism? It is a condition that really restricts the ability of a human being to communicate. And what about to feel? You know, some people say that autistic children don't have the same capacity to feel or empathise with another person.
Well, for one thing, they sometimes have a great deal of hypersensitivity where they can't stand their clothing. It's a way of feeling, I guess.
Okay.
You can't stand their clothing on their body, and they'll take it all off.
Yes.
And that's happened. And then the other thing is with regard to feeling, no, they can't empathize. They can't anticipate like what you may be feeling, and it's heartbreaking for the mothers that the children show no appreciation or no love, you know, for them. It's just a totally giving experience. And then when they can come back and reciprocate with, say, I love you, or hug them, or so on, it's such a great advancement.
Yes, that's true. Okay, so the definition of autism really is made by observing the behaviour and the symptoms of the patient. There aren't any tests that you could say, okay, this is categorical.
No, there are no specific diagnostic tests. It's the diagnosis is behavioral, and we use this 50-cent word. It's called a neurodevelopmental neurologist who would. I oftentimes don't make the diagnosis. It takes somebody to look under the specific DSM-3 codes or DSM-4 codes, and then tell us that yes, this child has autism or Asperger's disease, which is a higher form of higher functioning autism.
Yes.
And so the disease is not characterized by any specific test, but it's a behavioral diagnosis. And it's, if I might add, Sandra, the sooner it's made in life, the better off we are.
Yes, that's right. So when should a parent start to look for the symptoms of autism?
As early as possible.
Yeah.
And there are some children that the mother will say, you know, as soon as they were born, I could tell they were different.
Yes.
You know, and sometimes, it's happening less now, they would take the child to the doctor, and the doctor would say, oh, the child will grow out of it, come back in 6 months or a year. Meantime, valuable time is lost.
Yes.
So the second thing is to be aware of the immunizations. Certainly, immunizations are a factor. They're not the only factor. But parents report that after the second immunizations in the MMR or whatever at 18 months, you know, they within weeks or less they lose their speech, and
they regress.
And they regress. So that's called regressive autism. And there's a large number of children that happens to in about a year and a half. Some, however, it's an intrauterine situation, and as soon as they're born, it looks like there's something wrong. That's the time to act.
Yes, so there's different manifestations in that it can occur straight away or further down the track, triggered by various environmental factors, but it's good to be aware of the normal milestones, and if your baby is not really communicating with you from the age of 3 or 4 months, looking you in the eye and responding to emotional cues, if you like, then that would be a sign that you should have the child.
Milestones are very important because don't forget, it is a neurodevelopmental disorder, so they have impairment in their neurological development. So that includes they're not talking at the right time, and their balance is not good, and they're not walking, and these are all clues. And I think that's great to be aware of that.
Be aware of the milestones. So it's not just communication and emotional empathy, it's also motor skills that are affected in the majority.
Yes, one of their unusual impairments is that if there's a crack in the floor, and if maybe only an eighth of an inch high, they can't discern that between an eighth of an inch and a foot high, and so they will stop at that, you know, and thinking because they don't have the appreciation of depth. So,
interesting.
Yes.
Yeah, and that's universal, is it?
No, it's not always universal. I think the three things that we really discussed in the beginning, the sociability, the language, you know, and the repetitious behavior, they seem to be common factors.
Okay, and the delay in milestones. So that's given us a great understanding of what autism is, and that's very, very important, so we can recognise it early. And we're going to talk in the next segment on what are the causes of autism, which is a fascinating subject and very important to know, so that hopefully we can avoid some of those causes. Yeah, so it's been great talking to you today, Dr. Anderson.
Thank you.
And sharing your vast knowledge on this subject.